Mabuhay from the Philippines. This is Alfred again. We're continuing our series of the NCLEX RN test taking strategies. Today I will be focusing on number 6 and 7. I'll be combining both since they're pretty short. So let's start. If you see the number 6 test taking strategy would be if you see an option you have never heard of, do not choose it. Obviously, if you're not familiar or if you haven't heard any, if you haven't had any clue of what the option is talking about, I think it would be better if you do not choose it, since you have no idea what it is. It might be just a distracting option, so it's better not to choose it. The number 7 strategy would be choosing first. When choosing which patient to see first, make sure you choose the most unstable. I think this is they're talking about the triage. Okay, now to give you an example, multiple choice example, let's read. 30 people are injured in a train derailment. Which client should be transported to the hospital first? The first option, number 1 option, is a 20-year-old who is unresponsive and has a high injury to his spinal cord. Now, based on this situation, we will be I will be following this up with, the START terminology. START means simple triage and rapid treatment. Basically, it organizes or labels patients based on their severity and their need for immediate care based on color, right? So this first one, as you can see, is unresponsive. So we will categorize this 20-year-old as a black tag or expectant. These are used for the disease or for those injuries that are so extensive that they will not be able to survive given the care that are available. So being unresponsive, and especially with a high injury to the spinal cord, means the likelihood of this patient to survive is pretty low. So we will tag him as a black tag under the START terminology. Again, START means simple triage and rapid treatment. We're going forward. Number 2 option is an 80-year-old who has a compound fracture. Now, a compound fracture is a very, very painful condition, but yet it can lead to infection as well, tissue damage, healing complications, and specifically, eventually, a serious complication called compartment syndrome, which we'll not delve into. But with this number 2 option, we will categorize this patient as a yellow tag. Yellow tag because yellow tag means observation and require possible and later retriage as condition is stable for the moment, but they are not in immediate danger of death. These victims will still need hospital care and will be treated immediately under normal circumstances. See, this is a very under normal circumstances, but you are dealing with 30 people, and so this is an exception. So normally we would treat this person, this number 2 option, with a compound fracture immediately, but because we're dealing with the triage, we should attend to the one who needs our care the most, or medical treatment the most. So we will treat this number 2 option as a yellow tag or observation, while this number 3 option, a 10-year-old with laceration on the leg. Well, laceration can be a deep laceration, whether it needs suture or not. It's not really specified here, but we will assume that this 10-year-old can still walk, even though there is still a laceration, and we will tag this patient, a 10-year-old, as a green tag or a weight. Weight are reserved for those walking wounded. So we would assume that this patient is walking, since it's just a laceration and there's no measurement or how deep the laceration is. So this particular 10-year-old will need definitely medical at some point after more critical injuries have been treated in this particular situation. Now, the number 4 option is the correct answer, since this is the most needed. We need to focus on this patient, the number 5, since it's a 25-year-old with a sucking chest wound. The ABC would apply, right? The ABC would be the airway, breathing, and the circulation. So not all test questions because Sir Alfred said it's ABC, then we should treat ABC. So you should answer it in the totality of your knowledge, previous experience, and critical thinking on whether this is the correct answer. But with this particular test question, the ABC would apply, since there's a sucking chest wound on the patient, 25-year-old patient. That means the air pressure on the outside and the inside of his lungs is not conducive for him to breathe. Then this would be a particular person that we need to attend first. Okay, so moving on. Another example of ABC, right? The ABC, the airway, breathing, and circulation. Which child requires the nurse to notify the healthcare provider? Number 1, the 1-year-old child with iron deficiency anemia with dark colored stool. Well, that particularly anemia with a dark colored stool, that's probably because the patient is taking iron, and a dark colored stool is an expected outcome of this particular situation, the 1-year-old child. So it's not out of the ordinary. It's a normal occurrence. As well as number 2, the 3-year-old child with phenylketonuria, whose patient does not feed the child any meat or milk products. Obviously, we know that the PKU cannot have meat or milk products, and that's a normal situation as well. While the number 4 option, the 7-year-old child diagnosed with acute glomerulonephritis, has a dark tea-colored urine, and that's an expected outcome as well because of the infection of the kidneys, right? Now, the correct option for this particular multiple choice would be the number 3. Again, applying the ABC, or airway, breathing, and circulation,